If you came into our hospital right now for any kind of surgery and needed to go to our pre-admission clinic, before you get the great surgery you're going to get and great care from really well-trained staff, you're going to see 5 different people on 2 different floors. You're going to wait for them at every one of those, and you're going to have to move between them. Sometimes you even get sent back down to the first floor. There's lots of unnecessary waiting, lots of unnecessary movement, but we're limited by our building, which helps us understand what Winston Churchill meant when he said, "First we shape our buildings, thereafter they shape us." The idea being that the way things actually work is so dictated by the shape that it happens in. So the way that a building is constructed, where the walls are, where storage rooms are, all of that has an impact on the way that we can deliver care to you as a patient.
Or you can have the best technology, machinery, CT scans and all the rest, but if it's taking you forever to get somewhere, or if it's not fluid and efficient, then it doesn't matter.
So we call these the flows of medicine, and if you think about the way that water moves, it always finds the easiest path. Well, that's the way we want to think about how patients can move through our space, how providers can access the things that they need to deliver care for you as a patient, and how supplies end up where they need to be at the right place at the right time. And in the traditional way of running a hospital, sometimes it's been like we've wanted water to flow upstream. You would have understood all the services that have to go into a hospital, and you would have found a way to cram them in there. The unique opportunity we have here right now in Five Hills with building our new hospital is the chance to make a break from the traditional way of designing a hospital and design it entirely around these flows of medicine.
Patient flow is how easy it to get to your room, how easy is it for you to use that room, how easy it for you to be comfortable in that room.
In order to improve patient flow in our new hospital, we've included patients and their family members in the design of our new space, and we're using a process called 3P, which just stands for Production Preparation Process, and it involves bringing together all the people who will use the facility to design the facility.
We've turned to the patients and asked them what they think, because they're the ones who are in that spot. And it might be a workplace for us where we don't think about things because we're in and out there every day. But this is a strange environment for a family, and you really need input in terms of saying, what do they want?
It's nice to have an input, because I average a week in there with my daughter. And 7 times since October, this is at times home away from home.
We followed them, we measured them, and we saw how many steps that they had to put in.
As a parent, I go to this food station here to go get this item here. Even we find how far it is and how far you walk.
The flow from the time you step in, it's stop and start, stop, start, stop, start. But in this situation, you never go upstream.
It was awesome to watch our team that included doctors and nurses and techs and housekeeping and on, and patients figure all this out together.
What is an option for a parent bed? Like, that's where I stay, that's where I sit, that's where I sleep, that's where I eat. Looked at the different sizes, and I was able to go into that room and go, well, here's our different options that you've just showed me. Here's what's going to sit, and then have a nurse go with me. Well, if you have that sitting there, that's going to block my thing. And so it was nice to collaborate for all of us to go, oh, yeah, we can put this, so this one works best.
Through our 3P process, it's amazing how much we've been able to reduce movement and wait times. So coming back to the pre-admission clinic, where you used to have to travel to 5 different places around the hospital and wait at each one of those, we've designed it now so that you come to one place and all of those services come to you.
Well, flow supplies is primary for a lot of the departments when you consider, and really it's a materials management issue, but supplies also is reflected in some of the housekeeping issues that we deal with. But it's distance traveled for everybody.
The challenge with supplies is having them where you need them when you need them, and being able to store them at the point of care. And our current building doesn't accommodate that at all. And the part of that matters to you as a patient is, are those supplies ready when I need them? Or do they have to get looked for? And do I have to wait for them?
You don't have the stuff that you use every day and that you require in close proximity to the area that you're working in.
It's a dramatic difference. when you compare to our current facility where nurses are up and down the hallway all day long getting the supplies they need, to our future facility where all the supplies we anticipate they'll need in that room will be stored in that room.
You'll have one bin full of something, and then behind it will be another bin, so when this bin's empty, this one moves forward and the other one will be replaced with what you need. And this saves space, time, and energy.
So another great part of that is that it can be stocked from outside the room. So the supplies are there when the patient needs them, so they don't have to wait and they don't get disturbed.
Let's say I'm coming into the hospital to do my rounds. The more compact the hospital is, the quicker I'm going to be, then the more efficient I'm going to be in terms of getting around and seeing all the people that I need to see and doing all the tasks that I need to do.
So the reality is that when you as a provider spend your workday traveling all over the place, from floor to floor, swimming upstream because of the building you work in, it doesn't matter how good you are at your job, you won't be able to perform at your best.
We also saw how many steps the healthcare providers put in too.
Looking at it from a whole different set of eyes going, oh my goodness, I didn't realize that's how we looked. I didn't realize that's how we function. Because you've taken an older building and an older sketch and put all these new things into it.
If you measure every step that you take, and you can cut off steps here and steps there, you're eliminating waste. You put a couple of those savings together and suddenly you've got 5 minutes extra in the day where you might be able to achieve something more in terms of care. And this is what makes flow and efficiency in the way we do things so important, because all those little times add up and give you big saving.
In the new hospital, all the rooms are going to be privates. They're not going to be semi-privates where you have to share with another patient. So I can go into the room, have free movement, flow much easier, not have a cluttered environment. They're universal rooms, so they will all have all the equipment necessary to provide care for any sort of patient, basically.
And everybody brainstormed, so you had it from physicians, nurses, housekeeping, therapy, everybody put their ideas together.
What's been so cool about this 3P process is watching this team of providers come together and design a space that will get rid of movement and wasted travel and all that stuff, but also design a space where they can collaborate in a way that our current building just does not allow. So what I find most exciting about this is that we've been at this improvement work for a number of years and have done lots of really important work and great things, but we've always been fighting upstream against the building that we're in. And the great thing about this opportunity for us is that we can design a building right from the ground up that is shaped to deliver better healthcare.